elected representative of your class, and I think you guys chose well. I can't think of anyone better to speak from your class than Dr. Michael Pottash.
Should have gone after Will. Okay. Welcome, honored family, friends, and physician educators. So this is what it feels like to finish a medical residency. That wasn't easy. Night shifts, and admission notes, and putting up with surgeons, and that pager. I hope the phantom vibration I feel in my hip won't last forever. But we did it together, and now it is my privilege to represent the Jacobi Medical Residency. I wish to speak to you today about patient autonomy, and I will begin with these words from Voltaire. Doctors are men who prescribe medicines of which they know little, to cure diseases of which they know less, and human beings of whom they know nothing. I would argue that in the nearly 2.5 centuries since Voltaire made his observation, we have learned a great deal about medicine and disease. Since that time, we have more than doubled the average human life expectancy. We've formalized the germ theory of disease, discovered antibiotics. We invented vaccines and then used them to eradicate numerous epidemics, and we are on the verge of injecting human beings with viruses to combat cancer. Damn impressive. As doctors, we stand on the shoulders of medical giants. We have graduated from medical school with a fairly good understanding of how the body works and often how it fails to work. But there is much we don't know. Many of the clinical syndromes we observe are comprised of symptoms that make unusual bedfellows, occurring together in unexplained constellations. Despite the years we have spent honing our diagnostic skills by studying patterns and learning algorithms, autopsy studies suggest that nearly 1/3 of our diagnoses are incorrect. We often attempt to make ourselves feel better when we encounter an unfamiliar clinical entity by constructing an impressive biological model, but the fact remains that too often we do not know the true cause. And yet with all this uncertainty, we present ourselves as experts and exude an unwavering confidence. We want our patients to feel secure in our ability to care for them. We are the healers, and they are our patients. But we sometimes forget that the practice of medicine is engaged in a hallowed partnership. And occasionally we overstep. We might pressure an obstinate patient into a dangerous procedure. We might question the capacity of a psychiatric patient solely before refusing our proposed treatment. My earliest memory in clinical medicine is of 2 physicians bullying a stubborn patient into a dangerous treatment. Though the treatment was indicated, the patient did not survive it. He may have died a certain death without it, but he met a hastened end at the hands of his physicians. This stuck with me. For all that we know, there's still much we do not. This has been a reminder to me to educate, to spend the time that is necessary, and sometimes to engage with family, but above all, to honor my patients' wishes, even the ones I disagree with, even the ones that might bring about their end or prolong their suffering. That part only makes sense when we explore the values and experience of our patients. The last part of Voltaire's words still resonate. In human beings of whom they know nothing. We forget, in all that we have learned about how our patients work, we know nothing about them. We forget that they are the experts of their life's experience. Lest you think this is a 21st century problem, look no further than the New York Times, which recently published an op-ed article by a famous cardiologist entitled, "When Doctors Need to Lie," and included the sentence, "There is still a place for old-fashioned paternalism in medicine." I dare say many doctors still feel this way. Some still believe that patients are meant to follow doctors' orders. Some still don't appreciate that do no harm is intrinsically linked to autonomy, that harm comes in many forms, consequence. To many of us, the greatest harm that can be done is to extinguish our freedom to choose. Some do not realize that if a patient does not agree to a valuable medical recommendation, it is our shortcoming and not theirs. But we are learning, and though the task is great, it seems that in this new century we may have the collaborators we have long desired. A recent survey of the United States adults suggests health consumers are prepared to be our partners. 92% said they like being in control of their health, and 80% said they feel expected to manage their health. I am seeing more and more of these surveys, leading me to believe that this is more a trend than an aberration. With this year's unprecedented investment in health technology, especially focusing on patient engagement, it seems the holy grail of shared decision-making may well be in sight, and we must be ready. This brings me to bedside rounds, the practice where physicians discuss the medical plan at the patient's bedside, bringing the patient into the conversation. The power of bedside rounds, as I see it, is not as much a function of its utility as a teaching tool, but more for its ability to engage the patient in shared decision-making. We too often fall into bad habits, adjusting a medication dose or ordering an invasive test faster than we can think it. At times, we forget to consult the patient. Jacobi's patient population is a vulnerable one, both economically and socially, making this type of communication extremely difficult. That is why working in a busy public hospital is a great privilege, but also a great burden. To provide the type of autonomy that our professional oaths ask of us is all the more trying. I remember receiving an evaluation during my second year that praised my professionalism and leadership, but characterized my medical knowledge amongst my peers as merely average. But I was flattered nonetheless, because I'm happy to be average among this group. What I mean is that these residents are really smart. I'm talking the best and the brightest smart. I'm honored to be counted among them. But smart isn't what makes this group special. What makes them special is the way they treat their patients with kindness and compassion. They learn this from excellent medical school educators, I'm sure, and they learn this from compassionate educators here at Jacobi. At Jacobi, we witnessed the terrible consequences that economics plays in medicine. We have treated the haves, but mostly the have-nots. What our physician educators have taught us is that patients seek us out for many reasons. They come for medical care and relief from suffering, but medical care takes many forms, only one of which is medicine. They also require reassurance, compassion, and validation of their concerns. All of our impressive medical technology is useless if our patients are disengaged or unconvinced, or if they don't trust us, or if they feel we don't care about them. In a healthcare system of ballooning costs, kindness is free, costing a little more of our time and energy. To withhold that kindness is akin to negligence. And autonomy flows from these interactions. Capacity to make decisions is not an on-off switch. It changes based on emotional state, concern for the future, trust. It changes based on comforting our patients, assuaging their fears, earning their confidence. These acts strengthen their capacity to make decisions. These are the safeguards of autonomy. This is what I have learned at Jacobi. On behalf of the residents who generously asked me to speak for them, I want to thank first and foremost Dr. Goodwine, who works tirelessly to provide us with a fruitful internal medicine education. He is our guiding light, a well-organized guiding light. Of course, he couldn't do what he does without the support of the staff, Penny, Laura, Trish, Eileen, and Janet. Not only are you amazing, but you typify the values of our department. I want to thank our new chair of medicine, Dr. Felice. I'm sorry I fell asleep in your first lecture. I wouldn't dare to do that now. You have become a powerhouse of teaching and leadership, and I would hate to miss a word of your wisdom. Thanks to all our medical faculty who embody physician educators, I have learned something from all of you. A special thanks to my mentor, Dr. Hahn, who has fundamentally changed how I practice medicine, setting me on a unique path. I must congratulate the chief residents on a successful year. They tended their flock admirably and are true role models. Probably the most important thank you goes to parents and significant others, of course. They wait up at night, take care of our home base, and believe in us when we have nearly stopped believing in ourselves. They have our endless gratitude. And finally, thank you to the residents, my friends. I am humbled. I have no doubt you will accomplish wonders. Congratulations.